Hi everyone, this is Shirley. Today I want to talk about Botox resistance. Have you ever wondered why your previous Botox treatment can last 4 to 6 months, and then after so many years of treatment, it can only last 3 to 4 months or even less? This is called Botox resistance, which a lot of people can experience after many years Botox treatment. So the Botox resistance happens when your body is become less responsive to Botox or botulinum toxin type A medications. We have seen normally two different types of non-responders in the clinic. The first one is primary non-responders, which means from the very first treatment, that patient doesn't respond to the treatment at all. Then the second non-responders is like after so many years of treatment, that patients developed a resistance to Botox treatment, which means the longevity becomes shorter or their body just like not responds to the Botox as much as before. They might end up having more movements with the same dose. A lot of people thinking Botox is not working anymore, or the medication might have different ingredients in it, or maybe there are some problem with the medication. But the answer is it's not that Botox is not working well, it's we probably need to use a different strategy to treat those people. Another reason is because the short treatment interval. If your muscle still not coming back fully and you keep topping up every month or every 2 months, that interval is like too short, and then it can make the body react to the medication less by developing antibodies even quicker. The third problem can be your muscle is adapting to Botox. So when we relax the muscle, your muscle is kind of like trying to go back to normal and then adapt to that medication and trying harder to get back to the normal strength. The last one can be the metabolic factors, for example, like hormone, and then also stress, or also intensive exercise. Like a lot of bodybuilders can have a shorter longevity comparing to the general public. When you have the Botox resistance, what we can do, the first thing we can do is changing the brand of botulinum toxin. So different brand might have different mechanisms behind that medication. Some brands can cause less resistance and some brands can cause a bit more resistance. So do talk to your injector and then figure out which brand can be more helpful with the situation. So the second thing that we can do is extend the interval, which means give your body a little bit rest, not top up too often. The third thing that we can do is called tox holiday, which means we can completely stop the treatment for a year or two, and then we can restart with a medication which can trigger less resistance from then on.